there's been an explosion of activity in this area, and the results of treatment in this disease have meant that now people are surviving years longer than they did previously. In the previous therapeutic era, as it were, the median survival time was in the region of 8 to 10 years, and it's now increased to a median of 15 to 17 years. And so that is an extraordinary increase, and there are a variety of different drugs that are being employed in this area and being evaluated in clinical trials. And CAR T therapies, of course, are something that have made such a big difference in aggressive non-Hodgkin lymphoma, diffuse large B-cell lymphoma, and these are now being evaluated in follicular lymphoma too. And of course, CAR T is all about harvesting lymphocytes from a patient's bloodstream. These are then sent to a laboratory and are re-engineered so that when the CAR T product is returned 4 to 6 weeks later, those lymphocytes are primed to attack tumor cells. And this is now a regular treatment for people with relapsed and refractory diffuse large B-cell lymphoma. And we expect that there will be some further developments in the follicular lymphoma field. What we do know is that CAR T approaches do have some particular side effects. There's a so-called cytokine release syndrome, and there's a neurological syndrome as well. All of these are well understood now, and we know how to manage them appropriately. So familiarity really does help us, because we know how to warn people about those side effects, we know what to look out for, and we know how to manage them. So I think the outlook for low-grade non-Hodgkin lymphomas continues to improve. One area that I haven't mentioned, and I will just briefly now, are the so-called bispecific antibodies. So these antibodies, of course, are specialized proteins, and many people will have heard of rituximab, which is an antibody that binds onto CD20, which is a target on the surface of B lymphoma cells. Bispecific antibodies, they target 2 of those targets, and that bispecific approach, as it's called, is leading to some remarkable results in various subtypes of lymphoma. And I think that in the follicular space, that will produce some real benefits in the future.